You know, every single surgical instrument tells a story. Sometimes it's a simple one, about routine use. Other times, it's about wear and tear. But every now and then, that story involves a critical plot twist, the need for repair. And that really is the heart of the matter, isn't it? We're not just talking about equipment. When an instrument isn't functional, the entire engine of patient care just grinds to a halt. The OR stops, and safety is suddenly on the line.
So let's dive into that story of repair, because this is so much more than just simple maintenance. It's a critical control point in the whole surgical workflow, a moment where one technician's decision can create a massive ripple effect.
And it's kind of shocking how fast things can go wrong. Just one faulty instrument can delay a procedure, right? That means frustrated surgeons and climbing OR costs. But even worse, it could actually compromise a surgical outcome or, create a direct risk to the patient.
This all leads us to the first line of defense, actually identifying the damage. It's a technician's trained eye that stands between a bad instrument and the operating room. So let's take a look at what they're searching for.
All right, so what are the usual suspects? Well, we're looking for things like misalignment, where the tips or jaws just don't meet up quite right. Or corrosion, any rust or weird staining. Even little things like loose screws. And of course, structural flaws. We're talking burrs, tiny cracks, or sharp edges. The smallest imperfection can completely throw off an instrument's function. So once a potential issue is spotted, we get to the moment of decision. And this is where a technician's training and judgment are just absolutely everything. There's a clear process for this, and there is absolutely no room for guesswork. Now, the inspection itself has to be methodical. It has to be deliberate. You open every single instrument all the way. You test its movement. Is it smooth or is there a catch? You get it under a bright, magnified light, checking every single surface. And then you verify its alignment and make sure its structure is sound. And this right here, this is the golden rule. It is the non-negotiable bottom line. If an instrument fails even one part of this check, its journey stops right then and there. It does not go forward, period. So, the reasons to pull an instrument are crystal clear. Any kind of functional failure, any visible damage, any loss of sharpness or alignment, or really any concern at all that it might be a risk to the patient or the surgical team. That one move is a powerful shield for everyone in that room. Okay, so an instrument's been pulled. Now what? A whole new process kicks off. You can't just set it aside. It has to enter a very controlled, very documented repair workflow, so it's tracked properly from start to finish. This whole workflow is about control. First, you document and tag the instrument. This isn't just busy work. It's an unbreakable evidence trail. Then, you physically separate it from all the clean inventory so there are no mix-ups. From there, it heads to a qualified repair vendor. And, this is so important, when it comes back, it doesn't just get thrown back in the mix. It has to pass another rigorous inspection before it's ever allowed back into service. Really, the big takeaway here is accountability. A clear chain of custody means we always know where that instrument is, what's been done to it, and who handled it. It's an absolute non-negotiable. We've talked a lot about the process, the what, but let's shift gears and talk about the who, the person at the center of it all, the sterile processing technician. It's their mindset that turns a simple checklist into a mission for patient safety. And this quote just says it all, doesn't it? A technician isn't just someone who cleans instruments. No way. They are the gatekeepers. They are the first and most important line of defense, protecting that OR from failure, delays, and potential harm. But let's be real. With that much responsibility, it's totally normal to feel overwhelmed, especially when you're new. The pressure is just immense. You're always thinking, what if I miss something? All while the trays just keep piling up. And this is the constant battle every technician fights. On one hand, there's all this pressure to be fast, to keep the OR moving. But on the other hand, the core principle of the job is that real skill comes from careful, deliberate repetition. Confidence doesn't come from rushing. It comes from practice. So here's what you have to remember. There are no small tasks in this role. Every single instrument that passes through your hands matters. And every single decision you make, whether to pass it or to pull it, matters deeply. So if you only take one thing away from all this, please let it be this ultimate rule. When in doubt, remove and verify. If you have even the slightest hesitation about an instrument, you stop.
You pull it. You get a senior tech or a manager to check it out. In this job, asking a question is always safer than moving ahead with uncertainty.
At the end of the day, it all boils down to these three things. Stay sharp in your focus, stay consistent in your process, and by doing that, you make sure that you, the surgical team, and the patient all stay safe.
Because that's really what this is all about, right? This isn't just a job, it's a huge responsibility. Your focus, your skill, your commitment, it all directly protects the very next person on that operating table. So the real question is, are you ready for that challenge?